Welcome, everyone. Let's give 1 second so people can join in. Okay. Okay. Very well. Very well. Welcome. Welcome from New York. Welcome from those joining us from Europe, from Spain, from Italy, from England. Here we are in another webinar from our series New Frontiers of Human Rights, series that we had started already back in the pandemic and continues, and we still want to continue even further twice a year with this appointment, once at the springtime, once at the fall. So here we are with our spring webinar on the human rights for older persons, joined by our distinguished speakers. And I will give you just a quick introduction to our moderator today, who then will lead us into this conversation. I didn't present myself. I realized my name is Andy Moraes. I'm the director of the Institute on Religion, Law, and Lawyers Work here at Fordham University in New York. And we are one of the co-organizers of the series, New Frontiers from Human Rights, together with the Center for Politics and Human Rights at Sophia Institute in Italy, and the Center, let me say, Observatorio de Derechos Humanos da Universidad de Valladolid in Spain. And Esther will correct me if I pronounce it wrong, but hopefully I pronounced it right. So let me introduce our moderator, John Mensa, who is a Fordham alum, dear colleague. Dr. Mensa has graduated from our SJD program, and it is a legal academic currently working in nonprofit space, really passionate to bring together and working in a space where he can collaborate with both academics, grassroots, and inform systemic change, and has taught jurisprudence, international law, human rights. Focus on environmental law is also one of his passions. So, my dear friend, John, take it away.
Thank you very much, Andy, for the warm introduction, and then to everybody on this panel for making time to delve into such an important topic. And as we are all aware, the rights of older adults at webinar for today. As a global population ages, it's crucial to ensure that older individuals receive the protection, care, respect that they deserve. And as such, it's important that we gather as academics, as scholars, wherever we may be, to share ideas as we try to advocate for their rights. And today's conversation, we have Esther and then Lucia joining us. These are both experts in this field, especially in the field of human rights. And I look forward to a wonderful conversation with all of you. So thank you very much for making time with us. Without wasting much time, I just want to delve quickly into the very first question, which is when we talk about the rights of older elders or seniors, which demographics particularly are we looking at? Esther, do you want to start us off?
Okay, thank you. Thank you very much. Thank you for participating in this interesting webinar, because it's a very, very important topic today. It's true, the world is living an unprecedented demographic transition. The age pyramid that existed less than a half century ago has literally been turned upside down. The number of older persons is constantly increasing, while that of the young is constantly decreasing. More in Europe than in other parts of the world. People today live longer and enjoy better health than in the past. And according to the World Health Organization, the number of old people is expected to double from 962 million to 1 billion by 2050, and triple to 3.1 billion by 2100. So demographers have defined new categories of old age. For example, young old, those aged between 65 and 70, and the oldest old, which those over 75 years old. So yes, there is a transition in the world population.
Sophia?
Yes, and I think it's this change in the demographics that makes this such a timely question. Experts have called the aging of the global population one of the most significant social transformations of the 21st century, and I think there's no question about that. A couple of things just to keep in mind when we look at the statistics on the older population. As Esther pointed out, in sheer numbers, both in numbers of older persons and as a percentage of the total population, we're expecting a dramatic increase. In particular, those over 80 are expected to triple, be from 143 million now to 426 million in 2050. But beyond that, a couple of other specific things catch my attention when I look at the demographics. One, and I'm certain that we'll get into this in later conversations, when it comes to gathering data, we don't have uniform criteria. For some statistics, we're looking at people over 60. For some, we're looking at people over 65. And so sometimes disagreement about what populations we're looking at, I think gets to be a little bit difficult. A couple of other things is taking a look at the dramatic decrease in birth rate in a number of countries, coupled with the increase in the older population. And what we're seeing as a percentage is that the percentage of older populations is more rapidly growing in the global South, which traditionally had not been the case. And in many ways, that's a wonderful thing because it speaks to increases in medical care that are increasing life expectancy. But that's at a dramatic rate. And then I think the final thing that we'll see a bit more of is the increasing gap between the life expectancy and aging between men and women. And some of the problems that we'll be talking about in terms of human rights and older persons are much more dramatic for women. And yet globally, women outlive men by an average of 5.4 years. And that ranges from 2.9 to 7. So a lot of times when we're talking about the changing demographics of older persons, to a significant extent, those issues facing women are particularly dramatic.
Now, that also takes me to a running joke here with one of my sites where there's this man, he's about 60 years, and he keeps on saying that every day, every morning when I meet him, I say, "Hey, how are you doing?" He says, "I feel a day younger." And but conversations around people 60 and above is that they are the vulnerable category or the vulnerable demographic. So how has the increase in this population growth and issues like COVID and outbreaks of disease, etc., triggered the need to table conversations surrounding their human rights and all of that? Alicia?
Yeah, yes, you're right. The pandemic disproportionately affected older persons and exposed the severity of existing gaps in policies, systems, and services, especially for groups in condition of vulnerability, including older people. However, despite the positive initial steps made on the issue, older persons are not sufficiently considered within the international community's frameworks for the future. For example, the Agenda for Sustainable Development seeks to realize the human rights for all, leaving no one behind, but includes few references to older persons and even explicitly excludes older persons in some instances. Many members have not yet included older persons, their needs, or their potential in work towards many of the Sustainable Development Goals, even those where there is a explicit mention of older persons. There are only 4 mentions of older persons in the world text of the UN Common Agenda. And references to older persons are similarly limited in the Pact for the Future. The Declaration on Future Generations mentions older persons only once. So what we can conclude from these policy documents, instruments, that unfortunately older persons are not a priority of the international political agenda. And this is something that we shall change, mainly following a human rights approach. We will talk about that later, which I think is the purpose of this webinar, to promote the situation, to be aware of the situation of this part of the future generations. Because when we think about future generations, we think in young people. But future generations are also old people. No, this is, I think, a change of mentality we have to have. Do you agree, Lucia? Do you agree?
Well, I think there are two challenges that come to mind. One is that there are probably very few groups as more heterogeneous than people over the age of 65. And I think what we're seeing now when we look at retirement ages, people working well into their 70s and their 80s, that there are many people who the age of 65 is middle age. And at the same time, we see people who are very vulnerable as they reach older ages. So I think one of the big challenges is looking at the human rights question not from the perspective solely of those people who truly have significant needs that have to be faced, but also those people who are as fully participant in the lives that they had when they were younger. And I think trying to come up with a one-size-fits-all approach becomes harder. And in some ways, I think it's easier when you're looking at younger children, when you're looking at 5-year-olds. There's a more, I think, uniformity, at least around the center of where a child is at the age of 5 developmentally. But that's not necessarily the case for older persons. I think second, the intersection that we've seen between addressing the rights of older persons and persons with disabilities has a great deal of overlap, and I think a lot to learn as we approach both of these issues, but also not complete overlap. And so there are some similarities and differences. I think COVID-19, which is, as you started the question, John, I think in many ways was a nothing short of just a tragedy for older persons. When we look at what happened to older persons in particular, the isolation that older persons suffered, the realization of the lack of healthcare that many had, many deprived of visitors for month after month, things that we would not tolerate if they were imposed on our children were willingly or grudgingly accepted when they happened to our parents. When we saw the failure of nursing homes and communities to keep people safe, recognizing the shortage of critical care workers and how diseases spread because a limited group of care workers were working in multiple facilities. So I think it was a tragedy when we saw how healthcare was triaged with some blanket assumptions about the care that should be provided to older persons versus younger people, perhaps in the same condition. So I think on the one hand, that stalled a lot of conversations, but I think it also brought into very sharp relief some of the needs that older persons have. And while that immediate crisis may have passed, the questions of who do we prioritize in times of crisis? Do we have plans for long-term care? Do we have adequate housing situations that are safe and available? And how willing are we to isolate older people and sacrifice their rights in ways we would not tolerate for other people? I think those questions were all brought into sharp relief during COVID. And so hopefully future generations of older persons may benefit from what unfortunately was a really tragic situation for many of our elders 5 years ago.
Now, we are advocating that we pay closer attention to the rights of older adults. Now, are there any current legal or international frameworks or organizations that work directly on addressing the rights of older adults, and how are they functioning?
Okay, well, older persons are entitled to enjoy all human rights. Thus can invoke the general guarantees, mechanisms in human rights treaties or in the Human Rights Council. However, there is not a specific treaty to adequately protect and promote the rights of older persons at universal level, leaving them unprotected in many circumstances. In 2010, the United Nations General Assembly established an open-ended working group for the purpose of strengthening the protection of the human rights of older persons. The open-ended working group concluded its work in 2024, last year. In its final decision, the group identified gaps in the international human rights framework, plus a number of options to address those gaps. Among others, the elaboration of an international legally binding instrument to promote, protect, and ensure the recognition and the realization on an equal basis of all human rights of older persons. Likewise, in June 2024, also last year, there was a meeting, an expert meeting in Geneva, held by the Human Rights Council. And this expert meeting also concluded that states should adopt a comprehensive, legally binding international instrument on the human rights of older persons. The instrument must specifically address violence against and abuse and neglect of older persons, filling the existing gaps in definitions and protections related to ages and age discrimination. So there are some opinions in favor of a new treaty on human rights and a specific treaty on older persons, similar what we have at a regional level. For example, the adoption in 2015 of the Inter-American Convention on protecting the human rights of older persons, and in 2017 of the protocol to the African Charter on the rights of older persons in Africa represents a significant development. In the Council of Europe, there is not a specific treaty. Normative work conducted by the Steering Committee for Human Rights in 2012 and 2013 resulted in the adoption by the Committee of Ministers of a recommendation, which is not binding, a recommendation to member states on the promotion of human rights of older persons. And finally, in the European Union, it's protected by Article 25 of the Charter of Fundamental Rights, is the right of the elderly to lead a life of dignity and independence and to participate in social and cultural life. I think this is an important point that Lucia pointed out, that older persons are active members of the society. So it's not just to care. Of course, we have to care for old people, but also they are active members of the society. And this is also important in the human rights approach.
I think a couple of things that illustrates. I think in many places in the United Nations framework, there is concern with an interest in the rights of older persons. And the question is, where is the gaps? And so how do all of these fragments, in a sense, fit together? So certainly the Universal Declaration of Human Rights, the International Covenant on Economic, Social, and Cultural Rights, and the Convention on Civil and Political Rights should apply to everybody because by definition, universal. I think the problem, of course, has been in implementation, and have older persons been ignored in implementing those universal rights. And then certainly the regional conventions have highlighted some of the particular needs of older persons. We do see some explicit mentions of older persons in the International Convention on the Rights of Migrant Workers and the Convention on the Rights of Persons with Disabilities, explicit references. In the other conventions, there's reference to all people, but how fully has that been realized with older persons? We're now in the middle of the United Nations Decade of Healthy Aging, and an initiative spearheaded by the World Health Organization, focusing particularly on health questions, but obviously health questions implicate economic well-being, social well-being, and hopefully that is focusing some attention. And then there was an independent expert on the enjoyment on all human rights by older persons. And one of the contributions made by the independent expert over the past about 10 years has been thematic reports focusing on particular questions. And so just looking at the themes addressed by the expert, I think gives us a sense of some of those areas that need attention. So, for example, legal capacity and informed consent. Climate change and other disasters, what priority is given to older persons, violence, abuse, neglect, older persons deprived of liberty, questions of particular concern to women, age discrimination, problems with the data gap, emergency situations, automation and technology. I think that's another question that COVID highlighted. Is that a great way to become more connected, or does that further isolate people who don't have access to it? The independent expert looked at autonomy, caregiving, lifelong education. So I think there's a lot of research, a lot of awareness building. And then the question is, how do we implement those issues that have been raised over the course of this UN activity?
Now, as part of research and trying to implement, are there particular non-negotiables we should look at if we are trying to focus on adult and senior regulations for our society? Do any come to mind that you think that they should be non-negotiable?
Okay, I think what's more important is to find the right approach, right mentality to the point. The intergenerational society we aspire to shall only become an enduring reality if it is based on respect for life in all its phases. The presence of so many older persons in the modern world needs to be recognized as a gift, as a new human and spiritual potential for enrichment. It's a sign of the times which, if fully accepted and understood, might help contemporary men and women to rediscover the fundamental meaning of life, which far transcends the purely contingent meanings attributed to it by market forces, by the state, or by the prevailing mentality. I would suggest an integral approach to adult life. Integral means inclusive, balanced, comprehensive. The message of St. John Paul II at the World Assembly on Aging in August 1982 is very up to date. I quote, he said, "The old age must emphasize as not only an inexorable process of biological deterioration or as a period separate from the other seasons of life, but as a possible phase in the natural development of the life of every human being, of which it represents the culmination." End of the quotation. This approach is present in the Christian thought, but also in many other religions, philosophies. And what is even more important, postmodern world needs to learn to reintegrate death in human life, especially in the face of some transhumanist positions. Indeed, it might be stated that the way in which a civilization accepts old age and death as a constituent element of life, and the way in which it helps its older members to live their death are a decisive criterion of the respect which that society has for human beings. So I think we have to start from appropriate approach, and then, of course, to assess all these gaps, to be able to draft, in the case of international legal opinion, and also to learn from the regional treaties or the regional practice we have, and also all this work of these committees of human rights treaties, Lucia mentioned before, and all this experience of the independent experts. So we have a lot of information, but at the same time, there is a lack of data. There are not a lot of data about the situation of all people. So we need to do a lot of work, but I think we have to find the right direction and to consult experts and associations for the human rights of older persons from their experience.
And so you had asked what is non-negotiable, and I have a long list of things in my mind that I think are non-negotiable, but I think I'm going to start kind of picking up with what Esther said, which is, I think, any approach to how we advance the human rights of older persons has to be an intergenerational approach, because I think the worst thing that can be done is anything that pits generations against each other, because we are all part of one human family, and older generations were once the younger generations will be tomorrow's older generations. And so I think anything that we do has to look at what older generations can offer the young, what younger generations can offer the old. And so when we look at older adults, to look at them both as holders of rights and holders still of responsibilities. And I think fostering interdependence rather than a focus on independence or dependence, I think has to be a starting point for a society that's healthy, is seeing how all the generations can work together. And second non-negotiable, I think, is participation of older persons in everything that's done. And in a lot of the discussions on the rights of persons with disabilities, the slogan was always "nothing about us without us." And I think that is equally applicable here. And so, and by participation, not just older persons who are healthy and wealthy in urban areas, but what the experience is of being an older person varies so much on circumstances. So full participation. Third, I would say being respectful of differences in culture, family life, and traditions, and what the experience of being an older person means in different places, and striking that balance between what is universal and how is cultural difference to be respected in those ways that it needs to be. Just to give one very small example, many jurisdictions here in the US, but I think internationally as well, are looking at this question of filial responsibility statutes, whether or not there's a legal obligation of children to support their parents financially and otherwise. Well, that could be viewed on the one hand as a forced dependence that is insulting to and damaging to an older generation who are now at the mercy of their children. On the other hand, it could be viewed as this is a beautiful bond between generations that links them together. And which one it is, I think, requires a conversation about culture, tradition. So I think that has to be part of it. Next, I think we have to give much more thought to technological development than we have, and what the impact that is on older persons. Older persons were not digital natives. Even when I speak to people younger than me, I realize how far I am removed from the generation of my students. So certainly people's experience with this is different. And what COVID-19 did was accelerate the use of technology as a way to communicate. And this could help bind people together. It can provide access to information in remote areas. It can make care more efficient, but it can also further isolate people who don't have access to that or training. And so I think the impact of that, I think also non-negotiably is we have to give particular consideration to the rights and the care of older persons with various kinds of dementia. And that is a particular, the statistics on the number of people who will be living with that and the care needs that that particular subset of older persons will be facing is often not fully discussed. I think we tend to find it easier to discuss opportunities for people who want to continue to work or to participate. But in particular, I think the most needy of older persons, I think, have to be priorities. And connected to that is the discussion about capacity, guardianships, decision-making, and how we help there. And then, finally, I would say when we talk about end-of-life care and the increase in assisted suicide statutes in numbers of jurisdictions, I have a real fear that older persons are going to feel pressure in a culture that has a throwaway culture mentality. Will what's being presented as a right be presented to older persons as almost a responsibility or an obligation? And I have some very serious concerns about that. And I think concern about older persons also has to take a look at what that increased movement may mean, particularly for vulnerable older persons.
At this point, I'd like to let our participants know, or anybody tune in to know that there's a question box in here. So if there's any question that comes to mind, you can drop it in the question box and then we'll address it as we go forward. So we've talked about the demographics, we have talked about the research, how the approach to implementation and all of that. We have even considered some of the non-negotiables. Now, what are some of the likely challenges we are likely to face when we try to put together international legal frameworks which are direct for adult or older populations or older persons? Esther?
Well, I think Lucia has mentioned many topics that are very important. No, she mentioned the reports of the independent expert on human rights of older persons, and she identified very important topics. And I will answer for a more technical point of view, thinking on an international legally binding instrument. I would say that there is an important point, which is the resources and financial commitments, because we know that the implementation of the human rights of older persons need to have to integrate these financial commitments. And also, I think it's important international cooperation, technical assistance, capacity building, financial support to ensure the human rights of other persons. And also, it could be important to include a robust monitoring and reporting mechanism to ensure compliance and accountability. I think, at least in Spain or in Europe, COVID was a disaster for older persons. And we know that the supervision and monitoring systems failed. there was no control what was happening in the places where old people were living. And there are other 2 points that I want to come back with Lucia at all. For example, this digital gap between generations. No, if you will let me, I would like to present, for example, what we can do in the legal clinics. For example, the students, law students, can help all people to integrate this digital dimension, because it's very difficult sometimes. For example, we know that here also in Spain, we have a natural disaster some months ago with, I don't know the name in English. It is the floods, okay? And now they can apply for indemnizations. But for many people who live in the low flats, or people in the residencies for other people, some of them died, others could go up in other flats. And now for the procedure for the indemnizations for damage, it's very complicated. So they need help for that. No? And I think in the university, with these legal clinics, we can help old people in this digital gap. And also other point is family. I think family is very important, family approach, because sometimes at least in the United Nations treaty system, we work on rights of people, of some groups of people, children, women, disabilities, workers, and we are making separated fathers. No? And one thing we are trying to do as an humanity or the Folklore movement in Geneva is try to integrate human rights inside your family. I mean, a family human rights approach, and consider human rights also inside the family. And I think that for old people to support families in the care of old people. I'm sorry, I'm missing many things, but I think it's important to put all these aspects also from our experience, because my generation is a sandwich generation, because we are taking care of our children, but then we are taking care of our older person. And sometimes we need help also from outside to be able to support our old people. But I think it's a gift. It's a gift for us. And if we work on this topic, I think we can pay attention of these different aspects, not only technical, as I said before, but also other kind of approaches and issues. That will be my answer.
Well, I was happy to hear your description of the law school clinic, because I think that's a perfect real life example of that intergenerational collaboration that I think is wonderful for the students and wonderful for the older persons, and kind of figuring out, are there other ways that we can model that in solutions to problems and questions, and bringing generations together, taking a look at, what wisdom do they have that they can share, and vice versa. And I'm sure many of those law students probably learned a lot while they were teaching and helping an older generation. Just a couple of things that come to my mind. I think one of my concerns with the focus on a separate instrument is the possibility or the potential for fragmenting this notion of human rights being universal. And that's a concern of mine when I see separate human rights treaties pertaining to separate groups. In my mind, that speaks to a failure of the Universal Declaration of Human Rights to accomplish what it was hoped to accomplish. And I don't know if it helps or hurts to say, well, then we're going to focus on different groups and highlight it, or if the task is really to increase awareness of the Universal Declaration of Human Rights and how there are groups of people who are being ignored when we take a look at what the rights are that everyone should enjoy under that declaration and perhaps don't. And so kind of theoretically, that's one of my my concerns. I think as practical matters, one of the biggest drivers of many of these issues is attitudes of ageism, stereotypes of who older persons are, what they're capable of, what they are no longer capable of. And I don't know how to address that as a legal question and whether or not that is an education question. But it seems to me that that lies at the root of a lot of these questions. But I think the other thing that makes the rights of older persons a more difficult question to address is that very often, and certainly not across the board, but many of the difficult situations that older persons find themselves in is not a surprise or a new development when they reach the age of 65, but in fact, the groundwork for those problems was laid all along the way. So, for example, someone who has a lack of access to a pension and security in old age probably had difficulty with finding work under good conditions when they were younger. Somebody who is not able to access healthcare as an older person may have had difficulties along the way. Somebody whose family may not be close by to take care of them. It might be because the younger generation had to leave town to find work that they could use to support themselves. Or maybe they were not being supported in taking care of their children. And so as that generation squeezed in the middle, because of a lack of support for that generation, they were torn when it came to providing care for parents. And so I think that speaks to the need for a whole life approach to taking a look at the problems of older persons. I think a different situation that has arisen is for the first time, and I think 2018 may have been the year when for the first time the majority of the world's population lived in cities. And that, I think, also changes what older persons may need, particularly if it is younger people who are moving to the city in search of work. Does that mean that there are more older persons now in rural areas where they expected to be surrounded by extended family and no longer are? And so the component of supporting families as part of this conversation, I think, is really important, because it's, I think, very difficult to protect rights of older persons in isolation if they or their families struggled with access to basic rights throughout their lives.
Yeah. So when we're talking about the challenges, I think Esther and then Lucia, you both touched on how the university as an organization can contribute through their legal clinics and all of that. But what has significantly, or what would a significant role of an NGO, individuals, or others be in ensuring or promoting the protection of rights of older persons?
Well, I think this is something very clear when you follow the work of the Human Rights Council, for example, in Geneva, or following the work of the different expert groups, etc. I appreciate that the participation of NGOs is very low. There are few NGO organizations working on older rights. That's one something I see on the field, in the field. For example, when you can make statements when the expert is presenting a report, and there are 1, 2, 3 NGOs talking on that topic. So I think civil society can contribute to make all the people participate in the decision making. No, I mean, There is something in the middle between governments or local authorities, etc., and other persons. I think the NGOs and the associations have a very important role, and mainly to raise awareness of the situation of older people at risk of exclusion, for example, or extreme poverty, and cases of abuse. So I think NGOs and civil society, local communities are very useful for that. And I will encourage more NGOs to take part in these consultations, call for inputs. For example, now there is a call for input of the independent expert in the website. And I'm sorry, I'm going to quote again the legal clinic because it's also other thing we are doing in the University of Valladolid to publish on the legal clinic all the call for inputs to connect civil society and international organizations. Because as a professor of international law, I see a gap between, no, there is in the United Nations, there has been a progressive development of the participation of civil society, and there are many ways in which we can participate. But at the same time, I see like civil society or NGOs have not enough knowledge about how to do it. So I think the NGOs are very important to encourage different groups of people, but in this case, older people, to be more active and to have a voice in the international forum, as has passed with migrants or with disabilities, etc. It's a new group of vulnerable group of people that we have to support. That will be my feeling. And doing webinars like this is important to promote the rights and the discussion of other persons.
And I think I'd highlight just two types of organizations that I think have a particularly important role to play. One is educational institutions, universities for sure, but also high schools. When young people are figuring out, what do they want to do with their lives? How do they see their futures unfolding? Because with an aging population, the need is great across the board for people who are interested and skilled at providing the care, the services, and the advocacy that older persons may need. And there was one dramatic statistic in one of the independent experts' reports that said there's an estimated 13.6 million person deficit in formal long-term care providers. And so when we're looking at, again, high schools, universities, the training programs for people interested in nursing care, social work, medical school, how are we ensuring that we are educating people who may have that interest, but maybe didn't think about this as a possible career? In law schools, when I teach courses involving elder law, students have an interest in it. And so in whatever discipline, I think raising awareness among students is, you have this interest in social work, you have an interest in law, you have an interest in medical care, things like dental care, things that we don't always think about. In high schools, people who decide, I don't want to pursue a college degree, but I really want to do something meaningful with life. These are my skills. How can I put them at the service of others? People who are skilled in trades. Certainly we need people helping. How do we build housing that is adequate for an older population? So our architects, our plumbers, our engineers, our carpenters. So, I think making this something that's much more pronounced in educational institutions at all levels, I think may be very helpful. And then I think there is a truly important role for religious institutions. And I say that coming from the Catholic tradition, but I think this is something shared by many religious traditions, is that this, for many people, is the source of their local community, their local connections, their bonds with a family that is not family. It is local at the most local level. These are the people who know if they haven't seen somebody in a few weeks. These are people who very often will run institutions that take care of older persons, whether it's hospitals or nursing homes, daycare centers, and try their best to promote a sense of the dignity of the human person, not only in what is done, but how it's done and why it's done. And I think that is something that we sorely need. And so I think outreach to educational institutions, religious organizations can add another dimension to these discussions that I think on the ground in people's day-to-day life may make a big difference.
Yeah, I'm supposed to be moderating this panel, but as you're speaking, there are comments that came to mind, especially relating to the work that I do. So I believe that with the NGOs, since they are on the local level, interacting with the older populations on a daily basis, in terms of research, in terms of framing the policy or the law, and even in terms of how the older populations can take advantage of these laws that are focused on them. It boils down to them taking a leadership role in that, from a bottom up and then to the top level where the decisions are made. So that's one of the things that I think we need to pay closer attention to. Now, if we continue to work at implementing any such focused regulations for or focused legal frameworks for adults and seniors, do we see an influence on that in terms of future policies and all of that?
Well, what I can say is the Human Rights Council has doing a good work on that. There has been 3 or 4 resolutions adopted by consensus, which is not common in the Human Rights Council. So there is a consensus in the international community regarding that. And I can quote in the last resolution on human rights of older persons, the Human Rights Council calls upon all stakeholders, including states, the entities of the United Nations system, civil society, national human rights institutions, and the private sector to combat ageism. This is one of the problems we have, the ageism in the society, as a root cause of violence, abuse, and neglect, as well as to eliminate violence, abuse, and neglect in all their forms, and to adopt a human rights-based approach in all programs, campaigns, and activities relating to aging and older persons. So the proposal could be to introduce the human rights-based approach in public policies. That will be the point. And I think, again, regarding the associations and NGOs, they have to influence in governments in the implementation of these resolutions of the Human Rights Council. But let me to say something, because when I was listening to Lucia, something came to my mind that, for example, I'm talking about Spain because it's what I know close. I think we have to dignify the work with other persons, because sometimes they are not qualified persons. Sometimes if you go to health places, people working there are not qualified. So I think one measure governments can do in all these careers, like Lucia mentioned, I think we have to dignify the work with other persons. Not any, because sometimes you can see, even in the families, the workers with old persons are not qualified. Sometimes they don't find another work or job, so they work with old persons. And we have to change that. That for me, that will be a priority in the policies. It's the same that you need specialized people for working with child, or with disabilities, you need people prepared for working with all persons. They need a special care. Do you agree, Lucia?
On that point, I could not agree with you more. I think when we look at policies for adults and older persons, when we look at the people who do the day-to-day care, I think a big problem is qualifications. And I think some of it is the respect that we accord people who are doing that work. And so often they are so underpaid. So that even if somebody is qualified and goes into that with the absolute right intention and wants to do that, if the ratio of people they're caring for is not reasonable to manage, then there's burnout. People are overworked, and the potential for abuse and neglect increases. And I will say, I see here, and I think this is true in many places. When you look at the wages that are being paid for people who do day-to-day care for older persons, and the wages that people get working in an entry-level job in a restaurant, you do much better working in the restaurant. And that is also important work. But when you consider you have somebody's life in your hands and people are being paid so little, it becomes this vicious cycle of, so I think absolutely that has to be a priority. And I think when we look at policies, policy questions are also resource questions. So where do we decide whether it is a local budget, a family budget, a national budget? Where are we going to be allocating resources that are scarce everywhere, and doing high quality medical research, doing urban planning that supports older persons? But what are the research priorities so that goals that are set with a meaningful allocation of the resources that are needed? And that's not just public resources, but what can the private sector contribute with subsidiarity? What are the local institutions able to provide? So I think part of policy has to deal with, how are we allocating resources? What happens as well in research questions. And so there are a lot of questions that don't have data aggregated by age. So are there questions that we really don't know the answers to because we haven't asked and separated that data by age? So I think, again, part of policy is allocating resources financially, but also in terms of research, what questions are we asking as we take a look at that? And then I think, in addition, for future policies, how do we get people engaged and participating? And I think people have that as a goal, but it takes work in figuring out how can you best reach people. So I know university students are easy to reach because they are all here. They all have access to the internet. I send out an email, I give a lecture, and they are all in the same place at the same time. But that's not the case when you're trying to get full participation. And so what are some of the things we can implement as a policy matter that foster additional engagement of a wide sector of older persons in those decisions that impact them directly?
Just a gentle reminder to all the attendees, there's a question box in there. So if any question comes to mind for any of the panelists, you can just drop it in there, and then we'll give you a session to read it out or have those questions answered. Now, I'd also want to take us to efforts that are ongoing, and how can anybody support the movement to advance adults' rights? Are there any such efforts that any individual can partake in to advance adult rights?
Well, I think we have mentioned many ideas about that, but my final, because I see that we are near the end of the time, and I will say I think it's a common responsibility to build a more age-friendly society. for future generations. There's a common responsibility. Each one has his role as members of a family, of local communities, or national level, international level. It's a shared responsibility, and we have to build a more age-friendly society. And we have to make people to live. I mean, I'm afraid of that feeling of I'm getting old, and I am how to say it, a problem for the others. No? That feeling that I'm going to be a problem for the society. I'm going to be a problem for my family. No, we have to make a more friendly atmosphere for people. That will be my last suggestion, because we did a lot of comments on that. And thank you very much.
And I think my comment on this is I'm a big fan of the bottom-up approach. And so for people who are interested in this, I would say start at your local government, because they are making a lot of decisions about things as simple as transportation, or participation, or what resources are in your local libraries, or in a rural area, who's checking in to see how people are doing. And so I think sometimes it's easy to start out thinking big. And my suggestion for people who want to start out in trying to find solutions is start from the bottom up, start locally, and see what is it that you can do to make a difference for those older persons living in your community. And it may be both that you help out in your own community, but also there may be approaches then adopted in one local community that can be borrowed by others as a model for how things might be done. So I would encourage anybody, start locally, certainly within your family, but also in your local community, your local government, and see how you can contribute. And then, this sounds so small, but in interactions with older persons and discussions with older persons, watch how we talk about each other, so that we don't say and do those things that suggest that someone is a burden to other people. Because I think a big part of this is education. It is combating stereotypes and ageism, and sometimes those are the little things that I think people can do that can change minds and hearts.
So from today's conversation, some of the things that we have touched on would be that there's indeed a group or a demographic that we consider as older persons, but in terms of where we peg it off, and that is where there's a challenge. As in, some data are reporting even below 60, others are 65, and others. And then we have also spoken about the fact that issues such as COVID and other ongoing global quote unquote acts have affected these demographics. We also talked about the fact that there are existing frameworks in there, but as to they directly addressing these challenges that these older persons are facing, there are so many question marks that need addressing over there. And then we have also spoken about the fact that there are certain non-negotiables that we need to pay closer attention to. The non-negotiables fall in various categories, some being that the fact that we need to consider that older persons have grown from one generation into that category. So as a step-to-step approach, you lay the foundation so that when you get into that category, we are taken care of, or everybody is protected. We also talked about the fact that generally, there's the need for NGOs and other organizations to contribute in various ways. It could be the universities, it could be nonprofits, social organizations, local governments, and all of that. We are also talking about the fact that when these structures are put in place, it has an effect on future policies and how the future policies are shaped. And we have also mentioned the fact that there's a need for all hands to be on deck when it comes to such issues. So how do we get involved? You start from your surroundings, from the bottom up, wherever you find yourself, your community, your family, and in so doing, it will trickle up. Now, some of the questions that still are coming is that when we are looking for resources as to where, how to volunteer, where to volunteer, if my panelists don't mind, you can share some of those in the chat box for those who are looking at ways and means they can contribute, even beyond their communities and then beyond their families. We are also of the view that the work is an ongoing process and it cannot be done within, let's say, a specified time frame of, let's say, a week or two, but it's a gradual process that we need to work towards. I also want to open it up if there are any comments from our attendees. This will be a great time for you to chip in. And just as a reminder, this is part of a group of sessions of webinars which are focused on development of human rights, and plans are also in pipeline to continue to make it continuously, periodically, by so speaking, twice a year. So please be on the lookout for more information relating to future webinars. Yes, there's a finger up, Karen.
Thank you, John, and thank you so much to Esther and Lucia. It was really interesting and thought-provoking, and I have many comments, questions, but I'm conscious about the time, so I'll just ask you something that really struck me during the pandemic, and in particular, I mean, in the UK, I'm based in the UK, so that didn't feel that bad here, but I'm come from Italy, so I heard the news in Italy, and during that period, I think the intergenerational gap and clash really exacerbated, very simple things, but you see, there were young generations blaming the elderly because they couldn't go out because the rules in Italy were so strict. Older generation basically blaming the youngs for spreading the virus. So that was really bad and sad to see. And I think it was also run by the political environment at that time, which made it extra bad. So COVID, a parenthesis, hopefully, in our life, but that showed that the intergenerational problem exists. So I wonder, how do we overcome it? We need a change of culture for sure, but perhaps we also need a bit of, we need the law as well. We seem, some research, empirical research and socio-legal research seems to suggest that the law sometimes can influence the morality of people. So if you see something that is written in the law is more moral than something that is not in the law, which of course also negative consequences, because sometimes some laws are perceived moral and that's disputable. But in any case, what do we need? Do we need a cultural change? Do we need the help of the law? How do we do this? Thank you so much.
Esther, you want to go first?
No, I mean, I was listening and thinking that we have a public discussion. I don't think there is a lot of discussion about this. For example, after COVID, accountability, there was not so much reactions for that. There was a lot of problems in the management of the COVID, and I don't see that the reactions were so big. So I think public discussion, we need to talk about these topics, and we have to involve people and to make them participate in the discussions. Because if not, it's like a silent people, we don't know they are there, or so public discussion to put them in the center.
And I think that tension between generations certainly did come out, and you pinpointed exactly where the tension points were, that the vast majority of people who died of COVID were older persons. And so in theory, the restrictions that were put in place were primarily designed to protect them. The younger people who may not have been at as a high risk of contracting the disease themselves were subject to the restrictions to protect those who were most vulnerable. And so, you certainly did see those conflicts when, proms got canceled. And, you have 17, 18-year-olds saying, well, the danger to us is not that great, but we want to protect older persons. And so I did see those, and I think, like with any crisis, it brings out the best and the worst of people. And I think some of those conflicts we certainly saw. But I think it is right that now that it is past, I hope we don't see anything like that again in our lifetimes or a long time to come. But I do think that it's important to see what lessons can we learn for the future. And I think one of them is the accountability question. And there are some inquiries that are being opened into nursing homes and some of the staffing questions and some of the questions about, liability waivers that people had to sign that would exempt nursing homes from liability. So I think we have to look at those questions. I think we have to look realistically at what the impact was on the very young, not being in school for a significant period of time. And we have no idea what that's going to mean for those young people 10 years from now. So I think absolutely we have to have those discussions. And I think part of them, it is tempting to focus them on looking back and assigning blame. But I also hope that a big part of that is directed more toward how can we react better in the future, and what kinds of lessons can we learn to avoid doing that. And when I've did a little bit of studying on the last pandemic, at least in the United States, was in 1918, the flu epidemic, and there the vast majority of people who passed away in that pandemic were young people. And so I don't know if the response to that was different, but I think there are lessons to be learned, and those conversations are well worth having. And I agree very much with your point that I don't think law states always what is moral, but it shapes people's views of what they think is moral. And I think it's easy to say, well, if the law says it's okay, it has a presumption that this is moral. And we see all too often that presumption is not justified. But I think when we look at what we say in our laws, certainly we look at law as what protects key important rights and responsibilities. But I think we do have to be conscious of the fact that law also has a role in teaching. And that's, I think, what we say and what we don't say in our laws does shape culture and is shaped by it at the same time.
Well, I would like to add something about young people, also from the experience in the floods in Valencia and Spain. That was the young people who react immediately, helping people cleaning the houses and the old people. So sometimes I think I would like to end this webinar with a positive view of this intergenerational solidarity, because it was really exciting to see how young people spontaneously travel to Valencia to support, to help old people, because they cannot clean the house, clean everything. So there are positive view in our society, but we have to work for that.
Now, something also came to mind as we were speaking about the cultural element in it, where society is so focused on being nuclear as a family, instead of looking at the bigger picture and then a collective union. From my background, I'm African and Ghanaian to be specific, and the culture implications is that ordinarily we don't focus so much on the nuclear, but then they extend it. So there's always this conversation about, okay, we need to take care of grandma, and if that means we need to switch it around from periodically, and maybe she stays with you for a couple of months, she moves here, she moves there. So then there's a cultural inclination that we need to take care of the old, within the family. Is it a matter of, say, most societies do not pay close attention to that, and that is why we find ourselves in this challenge, and that should be something that can be replicated or talked about more, so that the idea is sort of indoctrinated to everybody. What are your thoughts on that?
Lucia, please.
I'll take a start at that. I think that for most people, when you ask older persons or really anybody what their ideal is and how they want to age, people want to be at home and they want to be with family as opposed to institutions. Not everybody, but that is certainly the presumption that everybody has. And I think that's fairly universal. I think one of the things I have noticed, and I saw this a bit more in some of the documents on persons with disabilities, is in some context, there is a little bit of, in law, a bit of suspicion sometimes of the family. And will there be circumstances in which the older person is then at the mercy of decisions that their family makes that might not be their own independent circumstances? Or will there be pressure within the family not to report abuse, or for a adult child to take over mom and dad's money when it's not theirs, it's mom and dad's, but well, I think I can manage it better, so I will take it. So I think, unfortunately, the law is almost written to respond to that very small, I truly believe, very small group of bad actors. So in order to protect an older person from the bad actors in their family, sometimes the law, I think, makes it in some ways hard for families. And so that tension between how do we protect against the bad actors and not yet make it harder for those families that really want to do the right thing, and the older person who wants to live in family. And I think lawmakers have to be careful not to take an overly negative view of human nature. And I think sometimes that's a temptation that gets in the way. But, I think absolutely anything we can do to make it easier, better for extended family, to support family, especially, and you mentioned the sandwich generation. If it's one person trying to take care of two generations, but maybe grandma has a sister who's also retired, and we don't think, gee, extended family, what can we do to help the two of them spend more time together so that the burden is not as concentrated on a small group of people? I think we have a lot of thinking to do about that, because I do think people, I'm an optimist. I think people do want to do the right thing, and the law sometimes needs to do what it can to help them, and sometimes it needs to get out of their way to allow them to do what I think people want to do if they can.
So on that note, I would like to bring this webinar to an end. Thank you very much, everybody. Thank you to the panelists and to the team for putting together this wonderful conversation. And like I said, it's an ongoing conversation, so you're going to have more series in the future. So thank you very much for making time with us.
And thank you, John, for moderating.
Thank you. Thank you very much. Thank you all.